We are now going to start a two-segment policy module. This is Global Lessons, followed by U.S. National Policy on Healthy Longevity for All. When we first conceived this, we were going to start with a fireside chat between former Speaker of the House, Newt Gingrich, and former Secretary of Health, Education, and Welfare, Donna Shalala, and we came so close, but the schedules just didn't work out. But the speaker did send us a message, a shout out. Bruce, do we have that queued up? Could we play that before we get to
play it? But Dr. Torres also worked with Donna Shalala,
That's right.
So we're all connected here.
Thank you for allowing me to spend a moment with you at this Targeting Metabesity conference. And I want to thank the Catalyst Institute for having made this possible. In addition, I want to thank each of you for being pioneers, for being involved in what I think could be one of the most exciting changes in how we approach healthcare. For all too long, we've played whack-a-mole. We've gone after the symptoms of aging rather than going after aging. And yet, it's possible that if we can actually affect the core challenge of aging, many, many disease states will either be postponed, disappear, or become dramatically less important. That's why I think what you're doing in developing a healthy longevity conference and the idea of looking at how we together can shift the American system from just focusing on disease after it occurs to focusing on actually actively preventing the disease by dramatically changing the process of aging. This is one of the most exciting developments in all of healthcare in the last 50 years. And I think what you're doing is at the cutting edge of a dramatically new and better approach to aging, to health, and to keeping Americans alive longer, better, more actively, and healthier.
Thank you for that, Bruce. Super. So a driving question is whether the US should adopt a national policy on healthy longevity for all. What difference might that make? So first, to look for examples and lessons from around the globe, let me recognize Tina Woods, founder and CEO of Collider Health, and the Secretariat Director of the UK All-Party Parliamentary Group for Longevity. And she will introduce our eminent panel. Tina, can you come live? Turn on your camera and unmute yourself, please. I see you, but you're still muted, it looks like, Tina.
Hi there, my camera is also just, let me just quickly adjust the camera. Here we go. There we go. Sorry, I just had to adjust my camera. Can you hear me now?
We hear you fine, but we see your static picture on the screen.
Oh, here we go. There we go.
Thank you so
much.
much.
Sorry about that. The video settings are a bit strange. Hello, how are you all?
Hello, everybody.
So we've got all of our panelists, I think. So we've got Lord Filkin. Jeff, can you put your video on?
I can't. No, they're not letting me do it.
Let's just see if we can.
Bruce, can you help Lord Filkin out? I don't know.
There it's done now.
There he goes.
There we go. Yes. So thank you so much for involving all of us in the session today. It was very interesting just to hear the comments made by Bruce, and really what we're very keen to share with you today is some of the approaches from around the world to look at how we can get healthy longevity on the map, certainly in the US context. So just a brief word. So I'm Tina Woods. I wear a few hats, and I was very thrilled to be at Metabesity last year as well. And so much has happened, obviously, in that time. So I run Collider Health. I work with Lord Filkin and been very involved in driving forward the activities of the All-Party Parliamentary Group for longevity. and Geoff will go into detail there, and as well as some of the key projects that have originated from the work that we began at the APPG. And my panelists, so I've mentioned Lord Filkin, but we also have Dr. Richard Siow, who is the Director for Aging Research at King's College London, who's also been very involved in the APPG. I'm very pleased to see that Francesca Carpenedo from Italy is joining us. So we all have a respective perspectives, and I'll let every panelist in turn sort of set the scene from their perspective. But just to sort of set out, I guess, the aims of the session, and we only have 45 minutes, but I do hope we'll get lots of questions on the chat. We're going to explore in particular the UK experience because we've been at it for a little while, and we'll share some of the lessons learned, what's worked and what hasn't worked in terms of healthy longevity policy. We'll be looking around the globe, and this is where Richard and certainly Francesca will have some lessons and experiences to bear, as well as some of our colleagues in the Southeast Asia, who I know have been very interested actually in the work of the APPG, to really work out, and I think the end objective of the session is to work out what is that list, our sort of top tips to advise the US on designing and embarking on a healthy longevity strategy. And really we're going to be probing whether there's a question whether we don't want to go down the rabbit holes, but we're going to ask, is there a one-size-fits all approach really to global longevity or not? And what are the common themes that we can share? So that's going to be the focus of the session. So with that, I'm going to turn to Geoff first, Lord Filkin, who'll introduce himself and set the scene for the UK context. Geoff, over to you.
Thank you, Gina, and good to be here with everyone. What I'm going to try to do in less than 10 minutes is really address why healthy longevity matters, what needs to be done, what really matters most in terms of improving it, and what are the key challenges and opportunities of doing so. If there's time, I might just speculate a bit on some of the assets that both the UK and the US have in this dimension, and also on some of the challenges we face. But there may not be time for that. I've got to go fast because there's a big sweep, so hold tight if you would. It'll be a high-level analytic. It'll be focused mostly on primary prevention rather than secondary or tertiary. Those matter as well, but one's got to select what one can cover in 10 minutes. Starting why it matters, I don't need to tell you this. It matters because of an enormous opportunity. In the UK, and I think in the States, we're living about 10 years longer than our parents' generation. That's 10 years more of life with the opportunities that brings. The downside is that many of us are living much longer in poor health at the same time. And living longer in poor health degrades the opportunities that a longer life gives significantly. We can contribute less economically, socially. Our well-being and happiness tends to be lower if we're in serious health conditions. And so it's a critical issue for improving well-being in our society. The second fundamental point is that there's a very big social divide between different groups in our society. If you look at the evidence in the UK, the people in the poorest areas get ill 20 years earlier on average than in the wealthiest. They die earlier and they live in ill health longer. So it's a quite remarkable social gradient, and that I think is true for the US as well. It's also, you say, a similar diversity in ethnic terms. It's not simple, there's some complexity there. And then it was all of this was highlighted by COVID. We saw for the first time how those who were in ill health were much higher risk of dying from COVID. To put it at its starkest, I asked the NHS to dig out the data for us, and of those who had died in England, 90% had significant prior ill health. Only 10% of those who died were healthy. So that's, in a sense, the context of why it matters. And it's been heightened, I think, in public consciousness, socially and politically, that our health has felt more at risk in the last 2 years than for many of us who had ever thought. That's both a threat, but it's also a phenomenal opportunity. As Tina will touch on later, it's also motivated business to realize that health is their business as well. So then, if a politician is coming new to this, as our Secretary of State is for health, what's to be done? And I'd suggest there are perhaps 3 or 4 fundamental initial framing issues. First of all, it's fundamental to make the case and keep on making the case for why this matters to government, whether it's at federal, national, or local level, publicly, to demonstrate the opportunities and benefits of individuals, to put out the data on happiness and well-being if you're in good health, so that in a sense there's an evidential base, but also that it's communicated in emotional terms so that people think, I'd like some of that too. I really want to have a healthy later life. And as has been touched on, it's a bit too late to start thinking about that when you're 65. So making the case and having mechanisms to do so, both politically, socially, from a whole range of organizations, is fundamental. Secondly, you clearly need a goal, you need a plan, and you need leadership. I want to tell you the good news first and the bad news. We're quite well off for goals in Britain. We've got a very important goal to improve healthy life expectancy by 5 years by 2035. That's marvelous. And also at the same time to reduce health inequalities, which is equally important. We've got a goal to go smoke-free by 2030, and we've got a goal to halve child obesity by 2030. The bad news is we haven't got much of a plan for any of those goals, and we aren't making anything like the sort of progress we need to. It is something, though, to have at least some ambition, and one should urge politicians to say, what are they really going to try and change? And then work from that, what do they need to do to make that happen? We've also got recently established, less than a month old, a new Office for Health Improvement, which brings within government the central leadership for this function, which again has great potential. We also should be optimistic. Sometimes when you look at the complexities of what drives ill health, it's easy to get swamped by the multifaceted, all-embracing nature. But we've made progress. We've made progress in Britain, and other countries have made progress as well. I think Adrienne was touching on that just earlier. If you look, our smoking rates have dropped dramatically in the last 30 years. We've greatly improved our detection and treatment of coronary heart disease, and we've greatly improved our detection and treatment of stroke. So you could identify a number of areas where with a clear focus and a drive, we've made great progress. And it's important to say that, otherwise it's easy to think this is an impossible endeavor. In the papers, we've written 2 big papers over the last, when I say big, they're both very short. We worked very hard to make them short, but they've tried to be high level and strategic. And they've had, I think, a particularly strong influence in government in the UK. The most recent one was looking at levelling up health in the light of COVID. Now, the challenge with improving healthy longevity is that the evidence is clear that very many things affect our health. Poverty, housing, stress, the quality of our work, our behaviours, etc., etc. The list is very strong, as WHO has documented. And that leads some to argue we've got to improve all of those things, and otherwise we won't improve healthy longevity. Well, I'd say half an amen to that. What I mean by that is, of course, who wouldn't buy that if it was possible? But if you talk to a politician like that, they just think you really aren't very grown up in terms of the real world. But in a sense, I think there is a fundamental issue that's necessary. People don't always like this, to try to analyze the evidence and data of what seems to be the most significant causation for the poor health in our society. The data's there, the evidence is there in WHO, we've done it in Britain. And just to give you the headline, 50% of the poor health in Britain is driven by 5 factors: smoking, poor diet, excess alcohol or drugs, insufficient physical activity, and air pollution. Now, there's 50% that's not covered by that, but at least being able to get your hand around 5 of the big drivers is an enormous help in strategic terms. So we have argued in the papers we've written, and we certainly have the Secretary of State saying he agrees with it, you have to focus on what you're going to try and change in the next 10 years. Otherwise, you'll be fiddling with an agenda of about 200 things and nothing much will shift. And the list I just gave you, that tends to be our focus. The next big challenge on improving healthy life expectancy is that it is so multifaceted. Even if you've got a narrowed agenda and say, trying to shift 5 big things, for example, the 5 I've talked about, and you will have a different top priority list. Even so, you will then realize that the drivers for those sit right across society. Some things can only be done by government, such as using regulation or taxation incentives, or giving grants. Some things can best be done locally or only local. Some things are best done by health systems to drive the change, and some things are basically driven socially and individually. And last, and not importantly, some things are driven by business. So any plan to address even the 5 things I've suggested has to think, how do you influence those five agencies of change, and which are most important for which particular topic you're dealing with. So you need a plan for each of those 5 goals, and then you need to think about how do you mobilize and motivate those agencies. No more time to go into that at this point. Let me switch then to what are some of the key challenges and opportunities. I'm going to be blunt about the challenges, but I also think we recognize it's a time of opportunity. What I mean by that is that politicians are more scared, more concerned. They don't want another crisis like this. They don't want to suddenly think that the economy stops or the businesses are at risk of collapsing unless we throw mind-blowing amounts of public taxation money at them to prop them up. So it feels like a turning moment. Chris Whitty, who is our enormously respected chief medical officer in England, you've got one of similar stature, you're lucky too, said to me, privately, so don't tell anybody. He said privately, we've got 18 months to really seize this moment, whilst the impetus is still there from COVID, and he's right. So the key challenges, and I'll touch on about 3 or 4 or 5 most. Political leadership, it's fundamentally necessary. It's a good thing when you can have it. It's not easy to get always. So how do we persuade politicians that this matters? Because there's a potential for doing so, because there has been a shift of the mindset by COVID. The challenge for politicians sometimes is that this is a slow burn agenda. If you build a new hospital, you could prod it and look at it and be seen cutting the tape. If you take action that reduces smoking or obesity, you don't see the benefits for 5 or 10 years. So the payback isn't always immediate. There's also a challenge for politicians is that an unwillingness to do what works. Being preferring to be driven by ideological views about what should be done rather than by the evidence. So ideological barriers are a significant one in the UK, and I suspect they're an even more significant one in the UK. For example, a libertarian argument says that if we give people the information and they then choose to go to hell in a handcart, that's up to them, and we shouldn't worry about it, and we should leave them to it. That's an argument that's false on several counts. It's morally false. And secondly, it isn't true that if you give people the information, it is adequate to bring about change. But it has impeded change in very many ways. To give you an example of it, we knew from the evidence from our academics that nudging people by fiscal means, by small price additions, makes an enormous difference in behaviour. We suddenly stopped getting free plastic bags from supermarkets when the government put a 5p charge. It was remarkable. Within about 6 months, we'd all stopped using plastic bags and we'd reduce the wastage from that. The evidence was similar, that if you put levies on business, if they have excess sugar in some of their drinks, what happens? They don't pass it on to the consumers, they reformulate. And yet we know that reformulating by exhortation does not work for good economic reasons. No time to go into it. So getting our politicians to recognize the sugar tax took about 2 years, and then it worked remarkably fast. And businesses avoided it by reformulating. The public didn't notice, and we got a lot of sugar out of our food system. But that's an example of where libertarianism has blocked it. Medical blockages. Traditional medicine itself is a blockage. This is speaking dangerous words to a medical audience. But there is a fundamental focus on treatment by medics. Why wouldn't there be? That's what they've been trained for. To give you an example from Britain, the NHS only spends 5% of its budget on prevention. It spends 95% on treatment, despite being on call for the consequences of not preventing preventable diseases in large amounts. Prevention for medics potentially is unglamorous, and yet we know in some cases you can drive down significant improvements relatively fast. Look at the different levels of detection of high blood pressure between Canada and the UK. If we'd got to the Canadian level of detection and effective treatment of blood pressure, we would have made significant improvement in our health prospects. The same is true of cholesterol. So there's a string of issues that are often low cost, but if we can stimulate and incentivize our healthcare systems to shift their focus, priority in the systems, we can make some rapid progress in some of these. Last, on some of the challenges, business itself. Business is an enormous force for good and an enormous force for harm on the health agenda. I don't need to talk to you about the harm that sugar does in our society, let alone tobacco, excess alcohol, or gambling. You know the sinners without me banging on about them. So it is fundamental that one finds a way of maximizing the positive contribution of business and minimizing the negative contributions, because business is so fundamental in our society. I'll say nothing more about that, because Tina will talk about that in a minute. Tina, have I got 2 more minutes or I'm out of time?
You can have a little bit more time. I'm just conscious that time is racing on. We have to...
Let me just finish with some questions to US. Both rich societies, both got great assets and strong scientific, medical and research bases. So we ought to be well placed to be able to do a lot. We both have the potential to use the crisis. Both countries were pretty poor in the way in which we handled the crisis. Does your insurance-funded system mean that you've got different, potentially useful incentives, prioritize primary prevention? NHS is an enormous asset in terms of its universal coverage and its phenomenal database to feed evidence and research. I'll say no more. And I think certainly in Britain, I don't know about the States, we detected the public themselves are more willing for change than they might have been 5 or 10 years ago, and more willing to do what it takes. So more than enough for me. I think in terms of where we're going on the UK, we'll be able to give you a better picture in 6 months, because government is beginning to unveil its thinking on this agenda. And Tina and I are enjoying working closely with it. Tina, over to you.
Absolutely. No, it's been a great journey through the last 2 years or so to navigate our way through this. Now, so Geoff has spoken very clearly about the opportunities and the challenges. And I think, you know, from what I can see, and just to comment a little bit about the journey that we've been on with the APPG work, is clearly you need ambition and you need focus, and Geoff spoke to that. I think he spoke also of the need to sort of change mindsets around, you know, and working towards a much more preventative sort of model, which I think is the crux that he spoke about. Challenge of the medics. I think there is a massive opportunity which we're focused on at the moment through Business for Health, which we set up through the All-Party Parliamentary Group as a recommendation. It was one of the 9 recommendations that came out of our original report, to just point about focus. So through COVID, we actually started that. And of course, the moment is really now to seize that moment. Chris Whitty, Geoff had pointed to, we also have the business community, who, and indeed we're working with the Confederation of British Industry, who had pointed and signaled that the opportunity is now post-COVID to really drive through some of the changes. So we're actually looking right now at developing a framework for health, mobilizing the business community as a key stakeholder to really look at moving the dial from a sort of a sickness model more to a preventative health model, really incentivizing long-term patient capital, to really invest strategically in long-term health prevention and care, which again addresses one of the points that Geoff made. Because really this is about system change, and that's really, really hard. And we have to re-engineer how all the stakeholders operate in the landscape. Geoff spoke a little bit about the importance of innovation, and of course, data innovation is a big part of this. Certainly in terms of the UK and coming out of the EU and our post-Brexit plan, science and innovation is a massive focus at the moment. So really sort of doing more to really understand and of course harnessing all the developments that we are seeing in the longevity scientific community is again another opportunity that can really drive through some of the changes that I know is the focus of the Metabesity conference. I'll just stop there for now to give Richard and of course Francesca a chance to kind of give their perspectives. But again, just want to really, really focus on what are some of the perspectives and experiences that we have faced, outside the US, that we can really share with our US colleagues in terms of reframing and actually the action focus to really drive through some of the change. So I'm going to hand over to Richard. So we know Richard, obviously, he's been very involved with the APPG and also our open life data work, which if we have time, we can talk a little bit more about. So Richard, I'm going to hand over to you before handing over to Francesca. So over to you, Richard.
Well, thank you very much, Tina. Also, thank you to Thomas, Adrienne, Zan. It's good to be back with you all. As you know, we all participated last year, and the world has changed again, 2021. We're still online, but we've learned many lessons through the pandemic, and it's good to share with you not only lessons learned from the UK and how we're developing our healthy aging strategy, but globally. So you all know this is the decade of healthy aging designated by the UN and WHO. What does this mean for us? What can we learn? We've got a lot to learn. We've got mountains to climb. As Thomas said, we're not quite yet at the peak of Everest, but we are approaching base camp. Some countries have actually reached a more advanced state in their population demographics compared with the US and Europe. Of course, we're looking at Japan and the Far East. So what have we been doing at King's College London? Just to introduce myself, I'm Director of Aging Research at King's. This is a multidisciplinary consortium where we consider not only the biomedical or the bioscience aspects of aging, but also societal, the impact of the aging population demographics on society, on business, and of course on technology. And also we are taking a life course approach. It's not only considering what happens after the population or the individual reaches a certain number, but what we can do from a much earlier time in our life course. And that time is actually from the time of conception all the way through to the end of life, and even considering what happens beyond. So our approach is to integrate both industry and also academic excellence. We have a lot to learn from our industry partners, as Tina and Geoff already alluded to, especially not the drug discovery and pharma, as we've been hearing a lot in the news, but consumer goods, because the vast majority of us have remained healthy and going to the supermarket. And that's where we have remained healthy. We've remained resilient because we've had access to the right level of consumer products. And we've also had a lot of education about what we should be buying. And quite simply, it's a balance between technologies available to enable us to make the right choice. How are we making a choice of whether or not we can go out? Because we're testing ourselves through the pandemic. And that's a very important factor to take into account. Testing, monitoring our health status, not only whether we have the virus, but what our health status is when we consider healthy aging. And this differs between different societies. What we consider healthy in the UK doesn't necessarily hold true for Italy or for Spain, and certainly the US, but also when we consider countries that are further afield. Japan, Singapore, China, our concepts of health are very different. And this is based also on cultural values, not only our concepts of health, but our concepts of aging and the elderly. So we really have to take healthy aging in the context of society and also, of course, socio-economic group. So again, at King's, we are considering all of these factors, how the societal also impacts on the biomedical. And biomedical also encompasses psychological status and psychological aging. What do we understand by aging and how we can implement this at the consumer level? What are the incentives? It's not only about taxing sweet drinks so that they're not affordable, but what are the incentives that we can consider as we influence policymakers? And that's not only the governments and governance, but also industry policymakers and business models for the consumer goods industry, how they can also play an important role in educating the consumer in healthier choices. And this is also very important when we consider the insurance sector. How can we academics work with technology partners and also insurance companies and the financial sector to enable those who are at a more advanced age, post-retirement, to have the financial accessibility to these resources that we find in the supermarket. So it's economics, it's financial longevity as well. All of this has to be integrated together for consumer health, especially when we consider the aging workforce as well. How can we implement this in the workforce to maintain productivity? How can we tackle age discrimination in the workforce as well? How can we enhance health and wellness so that we can increase productivity in the aging workforce? And what are the incentives? So coming back to tracking, this is already implemented, just to give a case study, where an insurance company is working with a health tracking company. I won't give away the names, in the Far East, in Malaysia in particular, where insurance companies are utilizing the latest in AI technologies, app technology for the consumer in the workplace, where we can monitor, where we can enhance, where we can provide access to education and health guidance at the consumer level. We don't have to wait until we go to the clinic or the emergency room. We can access this from our homes, from our workplaces. And is there an incentive? Perhaps if we reduce the healthcare premium by the individual in the workplace, is there an incentive to actually implement the advice given by the technology app on your phone? Is there also an incentive at the supermarket if we follow the guidance? So by working together with industry partners in technology, consumer goods, and also the financial sector, this enables us to better inform the consumer to maintain health throughout the life course. As we know, societies in the Far East, for example, Japan, population demographics, they're already approaching 1/3 of their population above the age of 65. Over the next 5 to 10 years, that is certainly the case. What can we do about the aging workforce, productivity, intergenerational working? These are concepts that have been developed throughout this conference already. And again, a major focus of the Decade of Healthy Aging is how we can reach these more advanced ages. 65 is not advanced. Maybe 90 is now what we consider advanced, but so that we remain healthy, well, and productive, and this will reduce the healthcare burden. What can we do in our 20s to 50s to mitigate the incidence of age-related decline? And this is through the consumer goods industry, the financial sector, not relying on the medical sector and drug discovery and so on. So many thoughts there, many case studies that we can look at where governments have already implemented policy. In Japan, for example, in Singapore, where there has been real investment at the community level, where the government has implemented plans so that they can tackle the advanced age of the population, to, for example, to reduce isolation, loneliness, a community spirit. This has shown clear benefits for the health of the aging population. And also, we have realized the benefits of intergenerational working, communities, that has improved the health not only of the elderly, but of the young. So I think these are some important considerations that we can learn from, we can implement, and we can improve, certainly. So I'm going to leave it there for now. We can come back to discuss some of these many factors later on. So thank you, Tina. And
Thank you so
Jeff.
much. Thank you so much, Richard. And you spoke beautifully about the complexity, really, of all the issues, the culture issues, and of course, mobilizing the force of the consumer and the business community, which of course are very, very strong tools in the toolbox, so to speak. So we're going to have an interesting discussion in a moment, but I just wanted to give Francesca a chance to share with us her experience, obviously working in Italy, advising the Ministry of Health, and also being very, very involved addressing some of the cultural issues that I think are very different around the world. So over to you, Francesca, and then we'll break out into a discussion.
Thank you, Tina, and hi, everybody there. Well, I'll start from Richard's words that somehow represent what happens, what is happening in Italy. The Italian political organization, I'm not a professional in medicine, so I'm talking about from the perspective of a civil society and NGOs. The Italian political organizations tends to issues when it comes to certain matters or when it comes to ruling the normal activities of the community, issues national frameworks and leaves to regions that are smaller political districts the initiatives to set the rules and the specific organization, and when it comes to the development of health policies and social strategies, among others. On this background, a triennial project on 2019-2022 involving the central government, the Italian National Institute for Care and Assistance, and other stakeholders such as civil society and higher education system has been promoted to create a multi-level participatory national coordination of policies in favor of active aging. Given the Italian fast demographic change, in 2009, 20% of the national population was age 65 and plus. In 2019, this number raised to 22.8%, and by 2025 then the rate is expected to raise to 24%, and at the same time the number of newborn child is slightly diminishing. Some Italian regions have already issued specific local laws to promote active aging, and others, 7 regions, have implemented some strategies devoted to the topic. Present, INCA, so the Italian National Institute for Recovery and Assistance, have published 2 documents, the state of art, so to say what is at present being done in Italy to foster active and healthy aging, in terms of the development of policies and good practices. And the second is a document bringing recommendations on what can be done to further develop the implementation of policies to foster active and healthy aging. These recommendations are built in the manner that it has been built as to recall the Madrid International Plan of Action on Aging, and so is being built in this way. And if active and healthy aging policies are meant to promote the creation of a community where older people's functional abilities are maintained in a way that they can continue to do the things they value in life, then the recommendation need to address the topic in a cross-cutting way, so to stimulate a coordinated vision in every level of nation and field of national governance. So this recommendation touch fields such as tourism, sports life, social services, and foster the mainstreaming of the topic of healthy aging in every policy that is being issued. So, please, Tina.
Yeah, no, go ahead. I'm just conscious that we've just received a notice that time is soon running out. So I'll let you finish, and then we'll break into some questions before we have to leave.
So what the recommendation says in general is that future policies, Italian policies, should integrate the Madrid International Plan of Action on Aging, and adhere to the Sustainable Development Goals. The active aging national policies should be multi-level, coordinated, and cross-cutting. Active aging national policies should be coherent with demographic changes. Sorry. Should match with domestic political framework and legal national system. Coordinate regional experiences so as to bring an homogeneous territory field of background. Develop multi-stakeholder shared policies and strategies. Foster a different narrative around the demographic change and around older people, and stimulate intergenerational dialogue, and promote the development of laws that have a holistic and life course approach, because aging starts from the day we are born.
Absolutely. You've set the scene really beautifully, because we've talked a lot about the life course, and what I'd like to do is just spend the last few moments really talking about, I guess, two things: cultural maps, and also we had a question on the chat line around prevention. And I know Richard spoke a lot about the incentives. So one of the things that I'd like to ask the audience, so you mentioned, I know Francesca, you mentioned the UN Sustainability Goals. Richard, you mentioned the Decade of Healthy Aging. One of the things I know with the work that we're doing coming out of the APPG is how do you incentivize more investment in prevention? We know that government and our public health system, for example, will only go so far. It's very in terms of investment, but also the short-term versus long-term nature of what's needed. So looking to the business community is one of the things that we're looking at. Business for Health is actually looking at bringing in health into ESG mandates to incentivize deep long-term investment into long-term prevention. So that's something that I know we're sort of pushing, and actually publishing a report next week about that. But just to kind of tie together some of the themes, because Francesca, you talked a lot about sort of local and community-based approaches. We've talked about cultural mindsets. We've talked about the need for prevention. Just a quick round the group discussion on what are the key elements. We may not have a one-size-fits-all approach to global longevity, what we can take to the US scenario. But what do you think are the things that can translate across, that any government, any nation should take on board in terms of reframing healthy longevity for all and making things happen? So Geoff, I'm going to go to you first, just to pick up on those key points. What should be on our list that we can leave our audience with? You framed it beautifully in your introduction. Oh, you're on mute.
Tina, can you hear me?
Yes, we can.
I go back to the WHO evidence that a very small number of factors account for a very high proportion of cardiovascular diseases and 40% of cancers. It is a quite striking piece of evidence. It's in our reports. But in other words, we know that if we shifted those 5 factors, we would have a very great significant improvement. So I would start there, and that I think those are true for most developed societies. So the question doesn't become what, it becomes how do you shift those, which at least helps. Let me stop there so others can come in.
Evidence of priorities and that focus is critical. And Richard, what about you?
As I alluded to, it's very important to understand healthy aging in the community, and it's the data that we are collecting. So through, again, the APPG for longevity, we have a open life data initiative or framework where we are taking steps to collect the data from the community. This is consumer data, it's life course data, it's not primarily clinical data. And we need to understand individual or personalized trajectories or signatures of health. And then we can better understand our trajectory towards healthy aging. So it's really important that we have the technologies. We also have the data analytics for this collection of very valuable data. So we are considering the value of data. Different stakeholders, for example, the government, industry, consumer goods, and of course the insurance sector all value this data for a business model, for perhaps provision of healthcare. And naturally, it's going to be reducing the healthcare burden. So better understanding of the value of data, how we're collecting it at the consumer level, and how we're integrating the data into policy decisions. We've seen good examples of using data during the pandemic, lockdowns and so on, vaccination data influencing policy. We can use the same technologies, the same concepts for healthy aging as well. I'll leave it there.
Yeah, so Richard, very, very good point on harnessing data. And I think you're absolutely right. COVID has accelerated the pace with which we've seen innovation, certainly in the UK scenario. And harnessing data, not just the sort of the sick care data that resides in our healthcare systems, but it's the data outside the system, which of course paves the way for some of the fascinating research in aging biomarkers and all sorts of research that I know is very much the focus of the Metabesity conference. So that's absolutely critical to this and opens up a huge array of innovation and potential solutions for healthy longevity. So Francesca, just a word from you, I think, on mindset, because I think one of the things that I know the APPG, I think the way that we have succeeded, I think, in driving some of the changes is actually seeing everything from an asset-based model rather than a deficit model, seeing the value of growing older, the benefits of growing older. A final word on that from your perspective?
What can be done to be sure that the next steps towards an healthy aging society is seeing people, seeing older people as a value, as an opportunity, see aging as an opportunity, and include older people in all the steps, in all the paths we are going through to build a better world for them, and in the end for us tomorrow, for ourselves tomorrow.
Absolutely.
And so a better inclusive society and the fight on ages and stereotypes, seeing older people as a vulnerable category or only a burden, or aging as a disease, which is not.
Absolutely, because we talk a lot about East versus West sort of philosophies, and I think that's where the East does get it right. They venerate age; it's seen as a good thing rather than a negative thing, which unfortunately does persist in the Western world. Ageism is still a real issue. So I think our time is up, but I would say that one of the most, in terms of the ingredients, we have to see longevity as an opportunity. We do have to focus on the long term, the prevention agenda. We do have to look outside the medical establishment for the answers, because we have to understand what is it that traps people in ill health. We know that's a drag on productivity. It's a drag on people able to work for longer, which of course the Singapore government, for example, recognizes. So they promote living healthier, the active aging agenda to support working longer, for example, and being productive citizens. I think the role of data and innovation is very exciting and will shape how we see healthy longevity, and it creates the potential and the opportunity and a positive sort of channel really to focus on. And I think the other idea that I think is also important is just, we talk a lot about national governments, national priorities, but there's something very, very important in harnessing the community, the local place-based approaches, which I know is the focus of UK government policies. How can we harness all the different actors that operate in communities, local areas, to really focus on the health and well-being of their citizens, as well as address the issues around inequalities, which of course are systemic in nature. So I think there's some ingredients there that I hope will be useful to anyone who's looking at how to get healthy longevity on the map and prioritize it for attention and funding and investment and policy change. So Thomas, I think we're running out of time.
So Tina and the panel, that was terrific. It's given us lots of food for thought, things that I hope we can directly transfer over to the US National Policy Session, which is to start at 1 o'clock our time, Eastern Time. We're actually headed into a short break. I'm being signaled that there's some technical issues, which is a good news and bad news, because you've given us a lot of food for thought. Maybe the bad news is we may have to keep you on a few minutes longer as we're talking until they sort this technical issue out. But if I could just come back to you a little bit, your panel, there are larger scale and moderate scale observations. And we have to figure out here in the US what sort of things we do to translate and take advantage of that. So for example, Richard's comment, just to take that comment about the importance of data and how COVID has showed us this. So how can we generate that, promote that for better decision making? Well, someone's got to produce it. And one of the segments in our US policy section, we're going to have Jay Olshansky, one of the original authors of the longevity dividend for us on this side of the pond. And the question is, where do we get that new data? Are academics just going to go off sui generously and do that? Or in some societies and political systems, government recognizes the value of that and funds that. We have some challenges on this side of the pond as to justifying public expenditures for various things. And in fact, we rely on the private sector to do things like help improve the psychological health of the elderly and so forth. So I don't know whether you have any further gems to think about how we transfer those items that you distilled so well.
So Thomas, if I can just mention a little bit of a word on that, because I know data silos and sort of guarding data and sort of, that's a really big issue. And of course, that's one of the things that we're really looking at with the Open Life Data Framework, which is one of the big projects that came out of the APPG, which we're literally about to publish the framework for in the coming month. And the whole point about that is to open up the innovation ecosystem, really taking lessons from other sectors. For example, like in the banking industry, we have an open banking standard, which has been very successful to open up innovation for the fintech world. And it was all driven by regulation that said, banks, you can't control the data. We want to open up data portability for consumers to choose what services they want. So that opened up a huge amount of innovation, but it was very much reliant on creating an open approach, an open standard. So those are the sorts of things that we're actually looking at the moment to take into the health and care space, but actually much broader than that, into the life space, taking, to the issue around life course. And you have to have a governance mechanism and abilities to share data, which is about breaking down the silos and creating the right incentives for the private sector, working with the public sector to share data. So that's the whole point of this piece of work. Because once you've got that, then you can start looking at aging biomarkers and pulling together all these sorts of things, which will open up all the innovation that we want to see happen.
I'm holding fast to Lord Filkin's encouragement to remain optimistic and not to be overwhelmed by the complexity of the project. I guess you folks are proof that you can make it through a gamut of many challenges and get to the stage on the ridge that you have. You're above us on the ridge toward the summit. But when you talk about that kind of data transparency, there are lots of things foundationally that we have to address in the US about data privacy and the access and transparency. So there are many interlocking factors. That's a question I guess I have for you all is, as you teased apart, you untangled the yarn ball to figure out how to do something at point A that we'll have point B, and that's going to push the ball along. Any tips on how to do that, or is that just old-fashioned elbow grease and getting a lot of people enthusiastic and excited, or were there some things that there are hacks that you can sort of give us some guidance on?
Well, certainly from our experience with what we've managed to achieve with the APPG and the projects that have come out of it, is obviously the mission, having the mission of 5 extra years of healthy life expectancy or minimizing health inequalities has been super, super helpful in the sense that it can focus.
Was that an easy lift? Did most people say, yeah, sounds good from their armchairs, and all of a sudden you had it? Or did you find people go, no, we don't want that, or there are much more important things that we need to address? How did that come about? Because we don't have that here. We haven't started that discussion here. Is this a 10-year project for you, or you did it in 3 months, or how did that happen?
Well, I mean, Jeff can speak to this as well, but of course it originated out of our industrial strategy and the Grand Challenge program, where there's a government commitment to invest quite heavily in 4 different technological areas. And the healthy life expectancy.
It was served up for you by some other predecessors. That's fascinating.
But Jeff, do you want to add as well?
Not totally. I think that the work on aging that we and others did 10 years or so ago identified, we were essentially addressing the question, what makes for well-being in later life? And to put it very crudely, the answer is good enough relationships, good enough health, and not too worried about money. I'm putting it very simply, but those are the fundamental things that do actually drive well-being. And therefore, quite a lot of work had been done on pensions and savings, which is clearly and keeping in work for longer, which is the money element of that. But the neglected area was still how to actually treat improving healthy life expectancy, which is why the Centre for Aging Better that I founded focused essentially on 55 to 65 years old, rather than older than that. And the policy work Tina and I have been working on for the last 2 or 3 years has just camped very resolutely on why this matters so much. You've got an enormous and shocking data in the States, haven't you, to show why it matters. If you look at some of your morbidity rates and the consequences of those morbidity rates, they're pretty frightening, aren't they? And the trajectories of, so,
and it's been amplified by COVID. It's like if you already were quaking in your boots, now it's in your face.
So pull that together into a 2-pager and say, up with this we cannot put. My job is always just to try to find the truth and just distill it into half a page, because that's all that politicians will ever read.
Well, you had a masterful distillation in your very quick opening statement. Adrian, I don't know, were you?
Well, if we have time, yes, if we have time, I have a question for Francesca, but I think then it will lead to everyone else. We just had a lively discussion with Dr. Torres, and one of the questions that I asked was whether or not the world of aging and the world of healthy longevity could get together to make change. And he did talk about the fact that there was this establishment. Now, Francesca, in Italy, you are dealing with a new policy, and that policy seems to be about active aging, meaning that we're starting at 60 or 65, hopefully going forward, because actually, shamefully for the US, you have a longer longevity average lifespan in Italy than we have. So it's the older age that you're looking to improve. But do you think that there is a way that that same group could begin to embrace what the UK has done, which is not just look at better aging for older people, but longer, healthier aging for everybody? It's a turning of the needle a little bit, but I don't know how we can make a coalition or an integration there. Do you think Italy is ready for that at this early stage of what they're thinking and doing?
Well, I think that many steps have been done from different perspectives. So there is not only the health perspective in considering aging and matters related to aging, or a way to address geriatric syndromes or something like that. So aging has been considered from different perspectives. So I think that we are talking exactly of active aging in a way that we need to find ways for people age 65 and plus to remain active, to remain productive, to continue contributing to the society, and to do to be good consumer and taking back Richard's words and being part of the society, continuing to be part of the society.
So
In that sense, we should Italian policy is fostering active aging policies in a way to foster all the people, or to allow all the people to remain part of the society, active part of the society.
So we are in the US more or less at that stage where we're looking and have been fairly successful in getting particularly people with some means to take a greater part in our society, be contributory, be healthier. But where was that moment in time for the
Adrian,
UK?
I'm sorry to interrupt, but I'm getting signals from our technical
Oh, you're
staff.
able to do it?
We actually have to terminate the session in order to start the other
I
one.
see.
So
All right.
sorry about this glitch, but really, really thankful, grateful to the Global Lessons panel. And I hope that we can carry some of those lessons over to the next session.